Thank you for choosing Guided Surgery Solutions for your guided surgery implant case. This provides an orientation and overview of the Thin Layer guided surgery system. Following research at the Harvard Business School with nearly 900 general dentists and specialists, the Thin Layer system was designed to provide excellent fit and retention, as well as simplicity and accuracy in drill trajectory and depth control. Unlike other companies which provide a single hard tube guide, Thin Layer provides a low-profile, precise, cost-effective guided surgery system. The Thin Layer tube guide is designed using a soft inner layer to provide excellent retention, while the harder outer layer provides sufficient rigidity for stability. The unique patented tubeless version of the guide provides visibility and access superior to tube guides and delivers the accuracy of guided surgery with the ease of freehand technique. The endofile and stop facilitate incision design through creation of a bleeding point, indicating the center of the implant platform. Custom drill stops, designed to optimize trajectory and depth control, are made specifically for your handpiece and drills. As will be described, other components are available to enhance your guided surgery experience. Except for the drills, if ordered, all components are single-use disposable and must be cold sterilized before use. Following trial in a large number of guided surgery cases, we determined that stepped drills greatly improve the ease of use as well as the accuracy of guided surgery. The drill tip, designed to be smaller than the fluted shank, eliminates annoying drill tip chatter and improves accuracy and ease of use. A series of short and long step drills with custom drill stops are used with the guides to produce a precise osteotomy prior to the use of the final proprietary implant drill. The step drills are optional order items, but are strongly recommended. They may be purchased or are available through a loan program. Upon request, loaners can be provided for your first case at no charge. The Perfect Pilot Drill Stop is an innovation designed to minimize drill tip deviation, a common problem in guided surgery. The Perfect Pilot Drill Stop extends beyond the guide tube to the level of the crestal bone, or gingiva, and constrains the drill tip at the level of the crestal bone. This eliminates drill tip deviation and provides for a highly accurate pilot hole. Provided with every case, the Perfect Pilot directs a short pilot drill for an initial shallow pilot hole, 3 to 4 millimeters deep. For immediate implants and sinus bumps, we provide specialty stops which replace or are used in conjunction with the Thin Layer custom drill stops. It is important to review all the materials included with your drill guide system, as well as to inspect the system components upon arrival. Please follow the specific instructions in the package insert. If you provided a stone model as part of the guide design process, test the guide on the stone model and follow the instructions for use. Make sure to sterilize all components prior to surgical use. Step 1. Create a bleeding point. It is recommended you have a cross-sectional view of each osteotomy site available during surgery, either as a printout or on a computer screen. Seat the drill guide and check the fit and retention prior to use. If necessary, trim the guide with a surgical scissor to reduce tension where appropriate. 1. Place the endofile stop into the guide tube. Place the endofile through the stop and twist to create a bleeding point in gingiva, indicating the center of the implant platform. 2. Remove the guide and visually confirm the bleeding point position and that it is consistent with the surgical plan. 3. If you are reflecting a flap, make the incision using the bleeding point as a guide. Commonly, the incision is slightly lingual to or through the bleeding point. Reflect the flaps. Step 2. Create a precise pilot hole. 1. Place the long-stepped Perfect Pilot drill stop through the metal guide tube. The stop should extend through the guide tube and contact or come close to the crestal bone. Place a short pilot drill through the stop and create a 3 to 4 millimeter deep pilot hole. 2. Remove the guide and visually verify that the pilot hole position is consistent with the surgical plan. Verifying the entry point and trajectory before the osteotomy is completed allows for correction in the unlikely event that the osteotomy position is incorrect. 3. To validate your entry point, place the pilot hole drill stop into the guide tube with the guide seated. Remove the pilot drill from the handpiece, place it into the drill stop, and tap the drill to confirm it passively drops into the hole. Using a guide pin or a probe, confirm that the trajectory is consistent with the surgical plan, or take a check film if desired. Step 3. Confirm drilling depth. To confirm your drilling depth, subtract the distance from the top of the guide to the bone, from the distance of the underside of the drill stop flange, when on the drill and against the handpiece, to the tip of the drill. This will be how deep you are drilling. In other words, the drilling depth equals the working length minus the guide height. For example, a 22.5 millimeter working length minus a 10 millimeter guide height equals a 12.5 millimeter drilling depth. Step 4. Prepare the osteotomy using custom drill stops. 1. After the pilot hole has been made using a short drill, place the appropriate custom drill stop on the first long drill in the series and slide the drill stop against the face of the handpiece. Place the drill through the guide tube and secure the tip in the initial pilot hole. 2. Center the drill in the guide tube. Tap the stop down into the guide tube. 3. Drill to depth. Take check film as desired. Repeat using the appropriate series of drills and custom stops. Step 5. Use of the proprietary drill, implant placement, and final verification. After the osteotomy has been prepared to depth using the previous drills and custom stops, the final proprietary drill specific to the implant being placed is used. 1. Place the drill through the guide tube or guide hole and secure the tip in the osteotomy. Center the drill in the guide tube or guide hole and drill to depth, controlling depth visually. No drill stop is used in this step, as the proprietary drill will follow the previously prepared osteotomy. 2. Place the implant through the guide tube or guide hole by centering the implant driver in the guide tube or guide hole and inserting the implant. Remove the thin layer guide and place the healing abutment or cover screw. 3. Replace the thin layer guide and verify implant position by viewing the healing abutment through the guide tube. It should be centered. The Thin Layer Tubeless guide is an optional item. However, we include it at no charge in your first case. This proprietary guide can provide enhanced visibility, intraoperative flexibility, and superior irrigation capabilities, particularly in challenging situations such as cases with limited vertical clearance. Once the bleeding point has been made using the endofile and stop in the tube guide and position validated, you may remove the tube guide and use the tubeless guide and stops for subsequent osteotomy preparation as shown here. The tubeless guide and stops can provide the ease of freehand approach with the accuracy of guided surgery. It is important to be mindful and cautious in performing guided surgery to optimize the potential for best outcomes as well as a positive surgical experience, possibly with reduced stress for you, your team, and your patient. There are many chances for potential error as you perform guided surgery, ranging from guide placement and design to surgical technique and intraoperative issues. Contrary to what many may perceive or even learn from the use of other systems and manufacturers, performing guided surgery is not as simple as placing a guide and using it like a drill press from beginning to end. For best outcomes, systematic, stepwise checking is required in guided surgery as previously described. In addition to preoperative assessment, make sure to verify your entry point and trajectory as well as depth before completing your osteotomy. These little extra steps can provide big benefits in your guided surgery on many levels. Please make sure to take your time and call us for any technical pointers. Finally, please review the materials included with your ThinLayer guided surgery